Good morning, dear listeners. Today we are talking about something deeply meaningful, that is on eye donation. Every year, millions of people suffer from corneal blindness, but the simple act of donating eyes can restore someone's vision and transform their life. Joining us today is Dr. Lydia Ndan, presently working as senior resident at Nagaland Institute of Medical Sciences and Research, Kohima, in the eye department, who will help us understand more about this life-changing cause. Welcome to our program, Dr. Lydia.
Thank you for giving me the opportunity to talk about eye donation as we observe World Eye Donation Fortnight from 25th August till 8th of September.
Dr. Lydia, to begin with, could you explain to our listeners what exactly eye donation is and why is it so important?
Well, eye donation is the voluntary act of donating one's eyes so that the cornea can be transplanted to restore vision in people who are blind due to corneal disease or injuries.
So could you also share who is eligible to donate their eyes? Are there any age or health-related restriction?
Actually, anyone can donate the eyes, irrespective of their age, gender, religion. People suffering from diabetes, hypertension, or those who are wearing spectacles also, they are eligible to donate the eyes. However, people with infectious disease like HIV, syphilis, hepatitis, and active eye cancer, they cannot donate because it is contagious and it will infect the recipient.
Dr. Lydia, how soon should the eye donation takes place after a person has passed away?
Normally, after a person is died, the eyes should be donated within 6 hours of death. Okay.
So if a person happened to donate his or her eye, would there be any cause of disfigurement to the face?
There is no chance of disfigurement to the face because we are going to take only the transparent part of the eye. We call it the cornea. We are not going to retrieve the whole eyeball, only the part of the eye. So it is not going to cause any disfigurement to the face.
I would also like you to explain how donated eyes are stored and preserved. Is there any cost involved in donating eyes?
Donating eyes is purely voluntary and free of cost. And the donated eyes are stored in a special solution. We call it MK media or toxin, and it is preserved in an eye bank usually.
So if any of our listeners or general public pledge to become an eye donor, what is the process involved?
Pledging of eyes should be done before a person dies, while you are still alive. Okay, you can pledge them. This ensures your wish is known and can be acted upon by your family members. Like firstly, you have to fill out an eye donation form online or at a local eye bank hospital. Register with a certified eye bank and you can receive a donor card that is optional. And you have to inform your family about your wish. They must consent after your death.
Okay, thank you so much for that information. So if there is someone who has already pledged to donate their eyes, what should the family do immediately after that person passed away?
After the death of that person, actual eye donation starts. Here are the step-by-step process. Firstly, the families of the deceased must inform the nearest eye bank or hospital as soon as possible. Within 4 to 6 hours after death, we have to keep the deceased eyes closed with a wet cloth over them to prevent drying. Switch off the ceiling fans and turn on the AC to keep the body cool. And the next step, a team from the eye bank, which includes a trained technician and eye specialist doctor, will arrive at the home or hospital where the deceased is kept. They will take a consent from the next of kin using a legal consent form. And once the consent form is filled, the cornea, which is the transparent layer at the front of the eye, is surgically removed. The process is done respectfully, meticulously, and hygienically within 30 to 45 minutes. There is no facial disfigurement. And the next step is the corneas, which are retrieved from the deceased, are stored in a preservation solution and taken to the eye bank They are examined, tested, screened and matched to the recipient. And surgery is scheduled to transplant the cornea into a blind patient suffering from corneal blindness.
Could you also share how many people can benefit from a single eye donation?
Like from a single pair of eye donation, like 2 people can get the vision.
So coming back to Nagaland, I would like to know the current status of eye donation in our state. Could you also kindly share some insights to our listeners?
Unfortunately, we haven't received any eye donors in Nagaland because there are many pitfalls. We don't have any eye bank like in other states. So the current status of eye donation in Nagaland is almost nil.
So Dr. Lydia, why do you think that there is still hesitant or reluctant about eye donation in our society?
People are hesitant to donate, especially in our society, because there is lack of awareness. Many people simply don't know that eyes can be donated or that corneal blindness is curable through transplantation. Some believe only full body or organ donation is possible, not just eye or cornea donation. Secondly, due to their cultural and religious beliefs, some worry that eye donation may conflict with religious beliefs or spiritual practices. In many traditions, there is a belief that the body should be cremated or buried intact. And thirdly, there is a fear of disfigurement. People fear that donating eyes might disfigure the face of the deceased, making the person look incomplete during the funeral. In reality, the removal of the cornea is done carefully and respectfully and does not cause visible disfigurement. Fourthly, the thought of a loved one's body being operated on after death is emotionally difficult for many families. In times of grief, family may not be in the right state of mind to think about donation, especially if it wasn't discussed earlier. And there are many myths and misconceptions. Beliefs like doctors won't try to save me if I'm a donor. Rich people get priority. It's illegal or risky. These myths discourage people from pledging their eyes. And there is lack of family communication. Even if someone has pledged to donate their eyes, families must give consent after the death. If the family is unaware of the pledge or disagrees, the donation often doesn't happen at all. And lastly, due to limited access and infrastructure in rural or under-resourced area, eye banks and retrieval teams may not be readily available. People might not know whom to contact or how to proceed after death.
Thank you so much, Dr. Lydia, for explaining us the reasons about the hesitance in our society. Well, to address these hesitations and myths, what steps State Health Department taking to raise awareness about eye donation?
There are different steps taken to spread awareness on eye donation at different levels of community groups of population. Firstly, at community public outreach, we're doing street plays, skits and rallies with slogans like Light Up Alive, Donate Eyes, doing awareness walks, marathons with banners and t-shirts. Pamphlet distribution is done in public places such as bus stands, schools, churches, markets, community halls, posters and banners at hospitals, schools, offices and marketplaces. In healthcare and institutional programs, we do talks and seminars in schools, colleges, churches, and local organizations. Special OPD awareness corners in hospitals with brochures and pledge forms. We involve medical and nursing students to do awareness drives. Eye camps is done in rural areas, focusing not just on checkups, but also on eye donation. And through media and technology like radio talks and jingles in local dialects, TV discussion and news coverage on eye donation Fortnight, share real-life stories of people who have regained sight after corneal transplantation, social media campaigns by doing short reels, posters, infographics on WhatsApp, Facebook, Instagram. And we can involve the church leaders, priests, pastors, and community elders to promote eye donation as a special noble cause. We can organize pledge drives after community gatherings.
Finally, is there a message that you would like to share with our listeners?
Observance of World Eye Donation Fortnight, let us take a moment to reflect on the purpose and the powerful message behind this campaign. It is said that the eyes are the window to the soul, and through eye donation, even after we are gone, we can continue to bring light, hope, and vision into someone else's life. Despite the medical advancement in corneal transplantation, the demand for donated eyes still far outweighs the supply. That gap can only be bridged by each of us choosing to become donors. And just as importantly, by spreading awareness in our families, schools, workplaces, and communities. Let this fortnight not just be a campaign, but the beginning of a personal commitment, a pledge to carry this message forward every day. Let's remember, don't just leave a legacy. Let your eyes live on. Give someone the gift of sight. If any of our listeners are willing to donate their eyes, you can call in this toll-free helpline 104 or search for a local eye bank in your area. You can dial 1919 MTNL toll-free number for eye donation 24 hours. For further information, you can contact a nearest PHC, government hospital, medical college, or any NGO hospital.
Beautifully said, Dr. Lydia. Thank you so much for your time and for shedding light on such an important topic. We hope today's discussion encourages many to come forward and pledge their eyes to give the gift of sight. Thank you so much once again.
Thank you so much.